Hello everyone, I'm Dr. Madhumita. I work in Dr. Deshpande's dental care as a associate dentist. So yesterday we did one full mouth case. So I had some doubts about it. So let's discuss that with our sir.
Thank you. I'm Dr. Pawan Deshpande, as you all know, from Dr. Deshpande's Dental Care. I'm more than happy to answer the question. Thank you.
So today we are talking about the smile makeover that completely changed one of our patients' look. We often hear about braces or filling in dentistry. So what is this FMR?
So basically, when your teeth are little more worn out, so what happens is over a period of time, a lot of tooth structure is lost for attrition. There are some cavities, and because of lot of overload, some part of the tooth is chipped off, and there is very little tooth structure remaining. And whatever the bite has been formed, that is also causing furthermore detrimental issue onto the teeth. So it is not allowing to function properly, and the forces are such that it is furthermore going to deteriorate the tooth structure. So what we are trying to do in this kind of cases is save as much as tooth possible and restore the bite and restore the teeth such that they can function for the longest period of time. Whatever is the life, we can push the life of the teeth for some more years.
Many people think few fillings can solve everything. Why wasn't that enough in this case?
Fantastic question. As you could see in this case, we had done a composite fillings on the front tooth as well, and that was holding for good 5 years. And what was failing was not just, it was not for just aesthetic or smile designing. The failing part were in the posterior teeth, the teeth which are behind premolars and molars. They were getting fractured, they were having erosion and abrasion kind of structure, and she was not able to bite at all because of that, and the chewing capacity had drastically come down. That was our chief complaint as well, because we had solved the smile issue for us. So that's how she had come back for to restore my bite so that I can chew properly. So that was the reason why the whole process was done.
You choose zirconia crowns for this patient. What made you choose only the zirconia for that patient?
So usually we prefer something called as a lithium disilicate or porcelain because that's the closest to enamel, and that doesn't require much of tooth structure reduction as well. But then when it comes to choice of material, two things make a lot of decision making factor. Like in the case which we had, lot of enamel had already was lost, and I don't think I can have a very good bonding with the dentine present, that to eroded dentine. So that was the one factor which pushed me to make a zirconia as a better choice, because in that case I can just cement it and leave it, whereas IMAX would always come back to me with a lot of debonding and kind of stuff, and that scared me to push myself to a zirconia.
If someone looks at the patient smile, will he able to recognize they are crowns?
That's a very good question. Most of the times when we do crowns and bridges, as you know, people do notice that it is a artificial teeth, isn't it? But the advantage of what we did yesterday was a very specific thing which was done by Dr. Aslam Inamdar, who has brought this skin concept, Paulo Cono's skin concept into dentistry, where we copy exact not only the anatomy but also the microanatomy of the surface of the teeth. And that's the reason why the prosthesis doesn't look like prosthesis. It looks like just another teeth, because it was the copy of one more natural teeth which we have copied onto the teeth. And this all is done just even before we have cut the tooth structure. It is not like regular crown cutting and then I am putting a crown. No, it is properly calculated even before I touch the teeth. I know where the teeth surface is going to be, and from there I am going to reduce, so that I am not reducing much of the tooth structure. I am saving as much as possible the tooth structure and replacing the teeth, and it looks exactly like the natural teeth. Yeah.
So, one of the biggest fear that people have is pain. So, is this process painful?
Most of the time, the pain is only related to if the patient already has an infection or if the patient is already going through some surgery or kind of stuff. But the kind of case which we did yesterday, I don't think even I used anesthesia. Hardly any anesthesia was given. That means what? It's hardly painful. And I don't think, because the tooth structure is also not cut most of the times, it's absolutely painless procedure, and we can definitely provide a long-lasting smile.
Like, how long does the treatment takes? What is the timing from the OPD till the last smile? What's the time gap?
That absolutely depends on case to case. Sometimes if there are implants involved or if there are any other surgeries involved, we will have to wait till that healing happens. Whereas sometimes it is just like the other case, nothing much is involved, which we can turn around in I think 4 to 5 days, complete from start to end. If the planning is there, if they start on during the OPD, if we can collect all the data and present to them something which is substantial, and if they accept, from the day of acceptance to the delivery, I think 1 week should be good. If nothing, no surgeries involved or no surprises.
A lot of people invest in zirconia crowns. So, what do you think? For how many days will they last?
So, this is a very sincere question by most of the dentists as well. Like, should we go in for PFM, metal crown, zirconia, or Emax or ceramics? I would ask the question, what does cause a failure? Is it the oral hygiene, decay of the teeth that is causing failure? Or is it the occlusal issues which we haven't addressed and that is causing a failure? Or it is a procedural inefficiency which has caused failure? So these are there are different stages of failure of what we fail as, we can say. But then when it comes to zirconia, that's my choice of material just because I need not cut most of the tooth structures. It's a very minimal tooth structure cutting and still I can provide very similar to what teeth structure can give. And the skin concept which we are having, that can only happen while we can do a milling. We cannot do that if it is a cutback layering or if it is a PFM layering. We cannot provide that kind of artistic work. So when it comes to that, we have a very limited amount of choices which can be milled. And only thing which can be milled and come very close to a natural teeth are either zirconia or we can say Emax or any pressed glass material.
Finally, for someone watching this who's been putting off dental treatment, what message would you like to give to them?
That's a very interesting question. Most of the times they are there, in the fear that they might have pain or it is a long process and they don't want to go through that process. And those are the fears which stops them from having a smile which they always wanted, or rather a comfort of life at that age which they always wanted. Just go eat whatever you want and enjoy the life. That's the part of life which is most often missing at post 60-65. And I would like to give them as early as possible. And the most common fear is this: I have sugar, I have diabetes, I have BP and whatnot, and how will I be able to cope up with all these kind of process? Maybe it is a long process and that's the reason why they think so. But I don't, as you saw, it is not that procedurally difficult as well. It's a 1 day investment and then 1 day for the whole cementation and it should be done.
Thank you, doctor, for explaining everything. If you have questions about your own smile, don't ignore them. A dental consultation can help you understand the best treatment for you. Thank you.